I'm delighted to be joined by the man who wants to run the NHS. Shadow Health Secretary Wes Streeting is in the studio. Good morning.
Good morning.
Keir Starmer said this morning that he supports the American and British action in Yemen, and he was informed ahead of the strikes. But did he suggest, as far as you know, that there should have been a recall of the House of Commons and a vote on the matter?
No, I think we understand that in some cases, like this one, government has to act swiftly and decisively and without reference to Parliament. Of course, it's always preferable, and successive Labour and Conservative governments have gone to Parliament for votes on military action. But I think in this case, it's an open and shut case. We've got the Houthis who've been threatening commercial shipping, and with it, Britain's economic interests, and subsequently has attacked HMS Diamond, one of our own vessels, with our service personnel on board. I think that absolutely necessitates a robust response. And as we already know, and we'll hear from the Prime Minister on Monday, these strikes were targeted and focused and absolutely necessary in Britain's self-defence and national interest.
You'll forgive me if I express some puzzlement, because Sir Keir, when he ran for election as Labour leader, promised, he said this, he'd never back military action abroad without a parliamentary vote. What's changed?
I don't think for a moment that Keir was suggesting that where urgent and immediate action is necessary, the government should be able to take it.
He would never back military action abroad without a parliamentary vote.
It
doesn't matter. He didn't say urgent unless it's urgent. He just said he wouldn't.
No, I don't think that's ever what he would have envisaged at all. And I think any reasonable person would understand that there are times when governments have to act quickly and decisively. I mean, can you imagine if in a situation where our troops came under attack, our ships came under attack, our air force came under attack, they said, oh, hang on a minute, everyone, before we sort of take off or before we open fire, we better just get on the phone because we're going to have to recall Parliament, get MPs from around the country, have a nice debate and then a vote. Come on, no one would reasonably suggest
I just want to be clear where we are, OK, because that wasn't where we were a few years back.
If there is a Labour government and Keir Starmer is Prime Minister and Britain's interests are at threat and immediate action is necessary, military action is necessary, we will not hesitate to act.
All right, on Gaza, you rejected the idea of a ceasefire. The South Africans have gone to the International Court of Justice in pursuit of a ruling which would have that effect. David Cameron's told me this morning he thinks that's just wrong. Do you agree?
I think it's a distraction from what needs to happen, which is the diplomatic heavy lifting to bring about an end to this conflict. You know, respect the International Court of Justice. It's for them to make decisions and judgments in relation to South Africa's
But you don't think it's wrong for the South Africans, really, to raise this issue?
It's a matter for the South African government. They're perfectly entitled to. The ICJ needs to hear their application and weigh up the evidence. But I actually think the priority here has got to be trying to get to where we were actually some months ago now, which is a humanitarian pause in fighting and the diplomatic heavy lifting to bring about the conditions for a sustainable ceasefire, which is what we all want to see. And you look at the scale of the bloodshed, you look at the scale of destruction in Gaza, the number of civilian casualties, they are disproportionate and it's horrifying.
But I'm not quite getting what your view is. Cameron was clear. He said he just thinks this is a wrong way to approach this problem. It shouldn't be going through a court. There's a political question. I'm not quite clear whether you agree with that or not.
I'm very clear. Our focus, Labour's focus and Britain's focus should be on the diplomatic effort to bring about an end to hostilities between Israel and Hamas. It is not easy. Hamas continue to say they'll carry out similar atrocities. They continue to hold hostages. Israel continues to bombard Gaza, and we've also got to see that in the context of some pretty worrying things that have been said by leading Israeli government officials about the long term and where they see this all going.
Let's talk about some of the things that you want to talk about. You've been talking about this week. You put forward a proposal for schools to encourage children to brush their teeth. Very worthy, and there may be some families who need this kind of guidance and support. But is it really the government's business to teach basic hygiene to the nation?
I wish it wasn't. It really shouldn't be. But when you've got tooth decay being the #1 cause of hospital admission amongst children aged between 6 and 10, And, you know, think about that for a moment. Things so bad, they're being admitted to hospital. That involves both a cost to the child and their health, but also a cost to the NHS, which I think is unbearable. And so if we know that there is a proven, tried and tested way of keeping kids' teeth clean and keeping them out of hospital, why wouldn't we take it? And that's why I put forward proposals for this scheme, which would benefit, you know, around 1 in 5
schools?
children.
Shouldn't parents and families be just doing this? Isn't this just a sort of devious way of saying you're not going to restore the collapsed NHS dental system?
No, quite the opposite.
No,
quite the opposite, Trevor. I think it's two things. One is it will take time to rebuild NHS dentistry. It is in such a sorry state, and I just warn people, if you want to know what the future of the NHS looks like under the Tories, look at NHS dentistry, which has been reduced to a poor service for poor people, if there's a service there at all. What we've got to do is to rebuild that. We've put in place a plan that will provide 700,000 extra emergency dentistry appointments a year, but it will take time. Even when that's successful, we still got to focus, and this applies broadly across health, on prevention, not just treating sickness, but preventing ill health. That's good for the nation, good for the public finances.
But I'm asking you this in context of some of the other things you've been saying. You're worried that our children are getting shorter and fatter under the Tories, apparently. I want to ask you about priorities. When it comes to academic performance across the world, in 8 of the top 10 performing nations, people are shorter than or equal in height to Brits in Singapore, South Korea, China, Canada. They're all shorter, but they're brainier. Are you sure you've got your priorities right here? I mean, do we need to get into a whole tall, short thing when actually we should be teaching our children better?
Well, I hope the Conservatives haven't beaten hope out of this country to such an extent that we now think we have to choose between educated children and healthy children. We can do both.
Yeah, but what you're saying is it doesn't matter if we're thick, as long as we're tall, right?
Hang on a minute, hang on. This week we've had a whole week of Labour and policy announcements from Bridget Phillipson, the Shadow Education Secretary, early in the week, talking about how we boost attendance, raise standards in schools, and towards the end of the week, myself and Keir Starmer focusing on children's health. These are all fully costed, fully funded plans. Let's not let any of these pundits get away any longer with saying Labour has no policies. You've had a whole week of policies.
For once, I'm not worried. I'm not bothering you about money, but this feels a bit like that you just enjoy telling everybody what to do. This is Labour bringing back nanny state, isn't it?
No, it's not. It's about Labour making sure we've got well-educated children and also healthy children as well. And broadly in health policy, we've got to, yes, get the NHS back on its feet and make sure it's there for us when we need it, free at the point of use, fit for the future. We've also got to focus on preventing ill health, and good public health measures can not just save lives but save public money, which is in short supply thanks to 14 years of Conservative failure.
One rather serious but little noticed announcement this week is that the Prime Minister's told civil servants that they can now talk to you as a prospective government and start briefing you and so on. Have you started to meet health officials yet? And whether you have or not, what is the first thing you're going to ask them to work on?
So I haven't had those conversations yet. Hopefully they'll be starting shortly. We have a plan, 10-year plan for the reform and modernisation of the health service. And I want them to start working straight away on preparing for implementation. We want to hit the ground running on day one. And there are a whole bunch of things that we will be able to achieve over the long term for the future of health and social care, and that's why we've talked about the need for a decade of national renewal. But there are some things that could make immediate difference, like providing 2 million more appointments a year to cut NHS waiting lists, extra evening and weekend working. We can get cracking on that straight away. The 700,000 extra dentistry appointments, get cracking on that straight away. Recruiting the mental health workforce to reduce the rates of suicide and self-harm amongst children and young people. We've got to get cracking on that, certainly, straight away. OK, that's your list. No doubt we'll be talking about it more as time goes by. Wes Streeting, thank you very much indeed.